There's tremendous need in many parts of the world, but there's also abundant resource. Connecting resource with need, that changes the playing field. In all of us is a desire to serve. It's innately there. When we objectify others, when we make them the objects of our compassion, we disempower them. When we make them the subjects of their own future, we allow them to write their own story. I think like a lot of organizations, when HBI first started operating, our focus was really on the initiation and engagement of projects. As though we thought in some way, if we got the perfect project, we could change poverty, we could end health disparity. Once the project was done, whatever resource you were providing is gone, and whatever impact you were making is ended. So we had to figure that we missed the piece, which is the community. They are the experts to creating the futures they need. They know the problem, and they have the solution. Our model is about collaboration. It's about pulling people together and building resources to overcome. And what makes that so unique is that when you connect the pieces together, the sum of the parts is so much greater than the parts by themselves. I first met a little girl by the name of Inez in an outreach clinic in an impoverished area. Her mother had brought her in with the hope that we could cure her disfiguring skin condition. And what I realized in interacting with this mother is that we had to help her just as much as we had to help Inez. So we had to think through, how do you empower the family themselves to drive their own change? And in doing that, what we built was a project that was strictly designed at helping people to help themselves.
The Inez Project is a really special project. We come beside moms who have the weight of the world on their shoulders, and then they have a very ill child. They are just looking for answers, they're looking for help. So we evaluate the family, we sit with them, we listen to them on multiple occasions, we will interview them. And with that, we are able to really pinpoint what are the small, subtle changes we need to make within this family to get them to where they want to be with their child.
And so what we found was that if we could teach, learn, and grow with the family by gaining access to skills to be able to access medication, access health services, understand how to even get to their appointment for the entire lifespan of the child, then it changes more than just the condition of the child, it changes the life of the family.
Todo aquello que violente la vida de una persona, le impida vivir plenamente, es algo que pasa por sus condiciones de vida. Las zonas a las cuales nosotros atendemos son situaciones, localidades donde falta el agua, la luz, la vivienda, el trabajo, la alimentación y, cómo no, la salud. Entonces, identificar las necesidades tiene que ver cómo una familia puede vivir plenamente la vida que cada uno de nosotros está llamada a vivir. Lo que estamos construyendo es una cultura de participación, una cultura de protagonismo, y el protagonismo de las familias que viven en la pobreza va a generar una nueva sociedad de ciudadanos conscientes de sus derechos y de sus responsabilidades, puedan ayudar a que otras familias puedan tener el acceso a la salud.
When you systematize things, when you build the models, when you build the resources to enforce those models, people then can take that model and use it in any way they need to. Certainly we could help to provide some direction, but the ultimate change that happened for Inez, that was her mother. That was simply helping them to find the skills and the knowledge to be their own greatest self-advocates.
Conociste a Inés cuando llegó a esa campaña y tenía 2 años.
Muy pequeña. El verla a Inés ayer me ha alegrado. ¿Por qué? Porque ella ha superado, entonces ha tenido que soportar todo ese sufrimiento, pero con la ayuda de su mamá y de las medicinas ha salido de eso. y ahora conversa naturalmente y tiene aspiraciones. Entonces, bueno, la niña ha crecido, pero la mamá ha crecido bastante también en cuanto a atender a su hija y a darle ese amor,
Pero ¿cómo te
ese
impacta?
cuidado.
¿Cómo te impacta a ti?
Me siento feliz, me siento feliz.
A critical component of the Inof project and all of the work of Health Bridges International is to drive need through the lens of local change agents who are aware of the need because they live in the local community and who are already beginning to form the solutions to that need.
For me, service means to be able to listen to the people around you and make yourself available. It's not a question of bringing foreign ideas, but to be able to have a real listening ear and be always ready to look for the best answer together with the community.
Most people aren't interested in asking them. They don't really want to hear the answer. But we do, because we know that those are the answers that are really going to trigger a change, not just with the families of sick children, but with the medical professionals that we work with, because they too have a deep need and a deep care for the people that they're serving.
Our goal has always been that we are continuously brokering more and more partnerships, and then we can take those partnerships and we can drive them down to the needs at community levels.
Nuestra función es una función de conectar recursos con necesidades. Lo importante de poder descubrir las potencialidades es poder ubicar la necesidad de la comunidad y la capacidad de las instituciones, de los socios, de la cooperación, de poder juntar tanto necesidades como potencialidades.
Our hope is that other communities can use these same solutions to address their own need and create their own change. That's the goal of all of the work we do, to build models that are transferable to areas wherever there is need. HBI aligns with the philosophy that slow and steady will win the race. That's the commitment. It's this continuous evolution that comes from being in relationship. And outcomes, they shift, they change.
There's no clear way of just saying $10 a day will support us to give 2 blankets to somebody. No, your $10 a day today might give transportation to somebody, tomorrow might give them a blanket, it might pay for transportation for a trainer to get to their location to teach them neonatal resuscitation. We have to be flexible because people are flexible and people have different needs.
Una verdad fundamental de HBI es que aspira a construir una sola familia humana, donde los más necesitados puedan ser el centro de nuestra acción, donde sigamos construyendo puentes en salud, de manera que la vida y la vida de los vulnerables pueda ser respetada, valorada y atendida.
We try to take the human being as a human being, no? When they talk to you, don't only listen to the words they say, but you feel inside what they are feeling inside. And in front of that, you cannot be indifferent.
¿Son amigas o siguen siendo pelinkas?
No, ya no peleé, son inseparables.
Parece que somos como los bebés, ¿no? Amigas, pelincas, ya.
HBI believes in people, and we believe in creating opportunities for them to really maximize their potential and create the hope and the change that they want to see in their lives and in their communities.
The work we do is not measured in days or even weeks or months. It's measured in years and decades. By taking a slow and steady approach, we allow ourselves to walk side by side with the communities we serve, providing a solution that best fits that community. That's the promise of HBI.